Good morning, friends. April here with Medwell Health and Wellness. I'm so excited. It is our fun Thursday. We are on Thursday today, Emily. So I actually can say my favorite day of the week.
Yes,
every
we're
day
back
that we do
on
Medwell
track.
Unscripted. Yes. So welcome, my friends. We're streaming live here for across multiple social channels. We're on YouTube. So hello to our YouTubers. Hello to our Facebook users. Hello to our Twitter friends and all of our LinkedIn professionals out there. It's good to see everybody today. Really excited about today. We're going to be talking some advocacy things today about medicinal cannabis and really kind of the cost barriers, seniors. And we have a great guest to share with you, Faye Berger Mitchell. She's a nutrition and cannabis consultant who advocates for cannabis, and we're really excited that she's here. Good morning, ladies. How are you?
Good morning.
Good morning. I'm really happy to be here with you.
Awesome.
Happy to have you, Faye.
So just some housekeeping, friends. If you are watching us live, feel free to drop a hello in the chat. If you are catching us after and we're getting the replay, please feel free to leave a comment or a question. We will absolutely get back to you. And because we are streaming live, technology can sometimes give us hiccups. So just bear with us if one of us freezes or we drop out. We promise we will be back to finish the conversation. And I do want to mention that Medwell Unscripted and Medwell Health and Wellness is in partnership with DocMJ. We provide medical cannabis certifications in Massachusetts, Ohio, Texas, Florida, Pennsylvania, Georgia, and West Virginia. So if you are in need of a medical cannabis certification in those areas, please do reach out to us at medwellhealth.net or docmj.com, or give us a call and we're happy to answer any of your medical cannabis questions. So without further ado, let's get started, ladies. All right. So Emily is our director of community outreach, and she's always busy in the community sharing about how powerful the plant is and about questions about medical cannabis certifications, qualifying conditions, and really how cannabis can make a difference in your life. Emily, what are you up to as we're kind of in the unofficial summer mode with Memorial Day just passed?
I know, it's so exciting. I couldn't believe when I was walking my dogs this morning how warm it is out there. It really feels like summer is now upon us. So it's hard to believe, but I'll take every second of it. Yes, it's very welcome from the winter time. So yes, I am out and about. You'll catch me at any of your local dispensaries. If you see me, please make sure that you pop on over and say hello. I love to be able to talk to patients as well as non-patients alike, so that if you have some questions about why you would get your medical card or what to do now that your medical card might be coming up on renewing time and you're not sure what to do, please make sure that you reach out to either myself if you see me or call over to one of our offices. Our amazing staff will be more than happy to assist with all of your questions. It's always an absolute pleasure to be able to help out patients again and non-patients. So for anyone that might be listening and is thinking about it, please make sure that you're reaching out to us. But yes, it's always just so fun for me to be able to see all of our dispensary friends and be able to talk to them and, hear what's new as far as products and what they're seeing and trends and things like that. And that information is what we, April and I will help bring to all of you to be able to share that knowledge. And that's why it's so wonderful to be able to have folks like Faye here today to be able to continue these conversations that we have and bring this education to all of you.
Awesome. All right. So my friends, today we're talking about when costs create barriers, getting boomers access with fixed incomes, but we also have some other great things to share with you today. So I'd like to introduce to you Faye Berger Mitchell. Again, she's a nutrition and cannabis consultant and a huge advocate in the cannabis industry. Welcome, Faye. How are you?
I'm great. Same thing, Emily. I'm very happy that the weather's turned. We're lucky here. We haven't been having much humidity at all, so it's been gorgeous out, trying to get outside as much as possible. So I'm doing great and happy to be here with you.
Awesome. So tell us a little bit about yourself. Let's share with all the goodness of all of your amazing traits that you have.
Well, I'm a registered dietitian originally, and I worked for 25 years. I had my own private practice and consulting business, and and then after, and we'll talk about this in a little bit, this is sort of how I got into medical cannabis, but I had to sort of stop my practice for a while for some medical reasons. And I became very interested. I became a medical cannabis patient because I had some issues after my surgery. And it was so fascinating to me and my science nerd kicked in and I started asking real questions. I'd go to the dispensary to ask questions. So I really got excited about it. And for a year, I took a job at a dispensary. And it was a lot of fun. I learned all about the Maryland medical program. Right now we're only medical in Maryland. We'll be going adult use July 1st. And after I worked at the dispensary, I wanted to further my education. So I went on to earn a master's degree in medical cannabis science and therapeutics from the University of Maryland, Baltimore School of Pharmacy, the first program of its kind in the country. And I graduated almost exactly a year ago from that program.
Wow. That's
congratulations. That is so wonderful.
Yeah, it's an awesome program. There are other ones that are now, coming along, but the fact that it's, administered through the School of Pharmacy really, I think, gives it some real legitimate, clout behind it. And I was back to learning chemistry and I learned pharmacology and I really challenged myself. So I like to joke, everybody learned how to bake sourdough during the pandemic and I got a master's degree. So
that's it.
Bake sourdough bread.
That's awesome. That's awesome. So you mentioned that you had a medical condition that kind of you became a patient. Is that kind of how you became part of cannabis? I mean, obviously, experience I think does go a long way, and then ending up with your master's, which is amazing. Right. So,
well,
can you tell us a little bit about that? I'm not
going to lie. I was no stranger to cannabis, but when it became legal in the state, my brother actually said my brother had become a patient because he has some autoimmune issues, and I was having some issues, and he just said, I just got my card, and that might be something that you might be interested in. And I was even just having some neck pain, not even related to the surgery, and he, told me about these creams and all of these things. And I'm like, that's a great idea. So my surgery basically was abdominal and it led to a lot of weight loss and lack of appetite. And, me being a dietitian, I knew all about this, but I really just couldn't eat. And so that was my main reason for turning to medical cannabis was I knew that it increased your appetite, could help increase the appetite. And that's what it did. And it helped me gain weight and sort of like get my life back, so to speak, because I had no energy to do anything.
Wow.
Interesting. Yeah. So, in terms of your master's, do you mind sharing a little bit about that? Because I think it's really, so we've had different guests, and we actually had a cannabis specific school that was a guest here, but I hadn't heard of your master's program until I read your credentials, and I really do think it's interesting because I know a lot of the local community colleges now have certificates and things like that, but it isn't always recognized as a degree per se. So that's why I find it very interesting. Would you mind sharing a little bit about that?
Yeah, I think that what was different about this program is that we really did a deep dive. I mean, we talked about evidence-based medicine and we learned how to research and we had to write research papers. Every week I was writing some sort of referenced, research paper with, footnotes and references and that type of thing. We were taught all about the history, the policy, the laws, the reasons why cannabis became illegal. We were also taught about, we discussed different types of conditions. And, while you don't prescribe cannabis, which products were most recommended, CBD versus THC versus hybrids, type 1 cannabis, which is primarily THC, type 2, which is a balance of CBD and THC, and type 3, which are CBD-based cannabis products. We also had a capstone project with a group, and my capstone project was fascinating. We had been reading about how there were increased visits to the emergency room by unintentional ingestion of edibles by children. And so we did a whole campaign for a packaging company about preventing the unintentional ingestion of edibles by minors.
Wow.
And it's becoming more of a problem, and it's something that we need to let the public know about. So we just covered the gamut, from stigma. We also covered the negative effects, because it's really important when we talk about cannabis that we don't only talk about the benefits, we also talk about the risks. So we learned every aspect that there is about cannabis. And it was not easy.
I was just going to say, Faye, that really sounds really incredible, because when you think about it, here you are doing these papers and having to put these footnotes in there, and there's really not a lot of, published, science out there that you can refer to. So that really had to be quite a feat for you to, find this information, to be able to quote it and make a paper out of it. So that's really just phenomenal.
Yeah, you really had to dig deep, and there truly are no very robust studies, because it's still federally illegal. So, conducting studies is a challenge in and of itself. So most studies were, retrospective or case studies, or, they were not like blinded, the gold standard types of studies, which is why I am advocating for federal legal status, so that we can start studying this plant medicine.
Right. Interesting. So let's get into kind of some of our topics for today. So thank you so much for sharing that, because I think it's super interesting. And I don't think a lot of people realize that degree is available. So thank you. So let's talk a little bit about kind of your experience. So you're a nutritionist, and you're an advocate in the cannabis community. What have you learned about kind of some of the financial barriers in accessing cannabis?
There are a lot of them. I mean, the first thing is that just right off the bat, there are the fees associated with becoming a patient. And as we talked about, every state has its own laws and requirements. First, many states require a fee just to register, and or just to prove that you are a resident of that state. So that's the first fee that most patients get. Then after that, they have to become certified by a certifying provider. And again, it varies state by state, but and the fees vary. But so that's another fee that needs to go out, and it can be, here in Maryland, it could be anywhere from $45 to $250, depending on who you see. And those fees you also have to renew. And so depending, again, Maryland did a good job. Initially, you had to renew every 2 years. They've changed it to every 5 years, and they've also decreased the fee for.
Wow.
So that's sort of an equity issue, because a lot of states are trying to build equity into their programs.
Right.
But then you also need to be certified by the doctor every year. So that's just like any kind of medicine, you can't just get medicine and not have a doctor be following you. So there's those fees. And then once you hit those fees, then we're talking about the fees of the products themselves.
Correct.
And that's often a huge barrier with patients, because they can add up. And so, oftentimes they're trying to figure a way to economically figure out what's the best way to provide the best cannabinoids at the best available price. And that's another barrier that we've really faced. And then another just final one is that there's no insurance coverage. It's federally illegal. I mean, they're just not going to cover that. You can't put it under your FSA or your HSA account, because it's not recognized as a medicine federally. So those are huge barriers. So it's all out of pocket if somebody wants to become a medical patient.
Yeah, all very good points.
Yeah, and and I think it's always interesting too, because like states are so inconsistent to one another, right? So like in Connecticut, it's every year. Massachusetts every year. I think in Florida, you have to recertify every 7 months. Like it's all over the place. You would think that there would it would be nice eventually to do a better job of everybody being on the same page.
Right. Which again, it's fun. I present to, I've done a lot of presentations to other groups of dietitians, because if our patients are using it, we need to know about it, whether they like it or not, or whether they approve of it or not. I say the same thing about doctors. You need to know about it, because your patients are going to come in and they're using cannabis and they're going to ask you a question. And I mean, at every point I made when we talked about whatever medical condition or whatever issue, at the end of the topic, it's like, that's why we need this to become federally legal, so that we can have consistent regulations and consistent standards.
Right. That's one of the things that I'm really proud of with Medwell and DocMJ, because we really try our best to give lots of different pricing alternatives so people can have access on the medicinal program, because, especially with the sales tax under rec, if there's rec in your state, and just really educating people on that. But we really try to accommodate, and do our best and work with agencies within our states to make sure that it is affordable, and that, our best to be affordable, and make sure that everybody can have access. So
yeah, that's awesome, because we need more of that.
For sure.
For sure. So what about seniors? I mean, obviously seniors live on fixed incomes, which makes it even more of a challenge. And it's not like Medicare or Medicaid helps cover that. So what has your experience been, or as you're kind of been out and advocating about what have you heard about seniors? What has your experience been about seniors getting access?
I mean, it's sort of the same information that I really talked about earlier. It's, do they have the dollars to cover what they need? And then there's another piece of this, is that, let's say a senior, let's say we determine a medical issue and we determine a product to try. Sometimes that product's not the right product. Right. And so a lot of times when I speak with people who are interested in medical cannabis, I do mention the fact that there might be a little bit of a waste of money, because let's say somebody purchases a certain tincture that we think is going to help them with their condition, and lo and behold, it really is not quite doing it. There are other options that we can try. And, in the traditional pharmacological world, well, then your health insurance kicks in, and, they'll cover that new product or that new drug that the doctor has recommended. Here, we're talking completely out of pocket. So, and they're the same issues that I talked about, earlier. And I'm glad that you all do have, programs to help with. Really, that's what we need, are more organizations that can provide a sliding scale. I mean, some doctors will do that. Some certifying doctors will do that. But, like I mentioned in Maryland, that's kind of why they changed their fee structure, was because they were probably hearing difficult to pay for them. People of lower income. This should not be something that only people who have a high income can access.
Yeah. Right. And you brought up a great point, because I just never thought of that in terms of product, where if somebody goes into a dispensary for the first time, and obviously, I think a lot of places have like patient care coordinators that help them the first time. Like in Connecticut, we have pharmacists that you talk to, but really talking about getting only a small amount to start, their lowest product point, because if it doesn't work, you can't return it and it is out of pocket. So, I think that that's a great point. A question that I never even thought to ask, as we've had some of these conversations.
And it's interesting, the higher CBD products tend to be more expensive. Right.
Which
is interesting. Sure. That's what, and so a lot of times, particularly with seniors, I lean towards a higher CBD product. Yeah. Because some of the interactions with THC, and they're more sensitive to THC, right. And with THC being psychoactive and CBD not, and they can really add up. So sure. and often you can't find like sample sizes, or when you go to a doctor, they can give you a sample of a
right.
And oftentimes they don't even come in varying dosages. So, you're buying the farm basically.
Right.
Right.
I should say here in Massachusetts, we're very fortunate. There's lots of dispensaries here in the state, for example, such as Netta, that will, once you become certified or you renew your certification, they give you 4 $50 coupons to use towards your purchases. And you can use up to $150 the first time. So that's really helping offset the cost of having to put out the certification, and then as well as, towards your product. So, it's definitely for those patients out there, that are dealing with, these costs, which, is certainly can be a barrier, but please know that, you've got your doctors and your dispensaries that are really trying to offset that cost for you. So please make sure you ask questions about that and what they offer.
Emily, I'm glad you brought that up, because most dispensaries around me here in Maryland do provide a 15% senior discount automatically.
Oh, good.
So 65 and over. It was 55 and then they changed it to 65, but 65 and older, they'll get a 15% discount.
Nice.
Most also dispensaries often will give that 15% discount to first-time patients. So I often suggest that patients, like if you find something, go to different dispensaries, that are nearby, so that they can get that 15%. Let's say they find a medication that works. Go to a new dispensary that's nearby, purchase more of that medication with their 15% discount. And then, as you know, things do go on sale. There are run specials or whatever. Patients can watch their dispensary emails or whatever to see when their products go on sale.
Yes, it's so true.
And stock up.
Yeah, that's such a that point, as well as traveling to different dispensaries. I think that some patients think that, when they go to one, they have to continue at that one. But I have so many patients that I've seen that say that they have so much fun when they recertify, because they take a little road trip with their friends and will hit all the different ones to be able to stock up on all their favorite products. And they, you can they're laughing and they make a whole weekend out of it. So, it's phenomenal to see that people are able to get access to the products they love and do it in a fun way where they know they're saving. So, a really good tip to mention.
Yes.
So so in kind of your experience where you have your nutritionist background and also the advocacy, what are some common questions that come up with cannabis that you find?
Well, questions that come up are things like drug interactions. Will I become addicted if I start taking cannabis? We talk about, a lot of people are very concerned that it's illegal at the federal level, so what will happen? And here, I live in Maryland, we're right outside. We're federal government land here.
You probably all live in your state.
Many of my friends, are federal government employees and are slowly retiring, and honestly are waiting to retire so they can try medical cannabis because they're not allowed to do so. The other thing is, they worry about, and it's illegal to transport it against state lines. And so I'm going to visit my grandkids and I really want to take my medicine, but I'm really not supposed to do that. So that's kind of another thing that they worry about. And so there's a lot going on with that. And, there was something else that, when we were talking about, financial barriers, there are also access barriers. For example, there are really no personalized recommendations from, well, sometimes there are, but if a person, depending on who certifies a patient, sometimes it's what I call these factories or certifying factories where they charge and then they spend 15 minutes with the patient and they just basically check off some boxes, the doctors, who these doctors, and then they don't really give recommendations. And so getting good, accurate recommendations or personalized recommendations can sometimes be a barrier. Traditional doctors are afraid to talk about it, because they either say, I don't know anything about it. That I talk to my doctors, they're like, I don't know anything about it. Now, my doctors know I'm a healthcare provider, so they trust that I know what I'm doing, but a patient asks a question, they don't know how to answer. or they're afraid to talk about it because of its illegal status. They're afraid they're going to get their license taken away, which I don't think is going to happen, but there's fear and stigma around it.
Yeah.
And the other thing with particularly seniors, is if they live in certain facilities, independent living facilities, or assisted living facilities, they're not allowed to use cannabis on those campuses or on those grounds. So technically they're not even supposed to use edibles, but most places have a no smoking rule.
Right.
So,
yeah. All good points.
So let's talk about your advocacy work, because you've been out and about, and when we were in the green room here, you were sharing some recent experience up on the hill, so to speak. Share with us what you're up to.
So I've recently become involved with the Americans for Safe Access. And really, if you're interested in learning about legalizing cannabis, it's a really great website to visit. And the Americans for Safe Access really have a plan that is really viable, that would really help for federal legalization. So we all know that cannabis is a Schedule I drug, meaning that, or it's scheduled under Schedule I, meaning that it has high abuse potential, or it's highly addictive, and it has no medicinal value. That's what Schedule I means. Most of our listeners know. And we all know that that's not the case. And we all know that, that's archaic, and, as some of the laws are based in racism and that type of thing. Their idea is to create a brand new schedule, a Schedule VI, because cannabis is whole plant medicine. And all of the other schedules really are talking about an isolated compound. No other pharmaceutical drug has so many compounds within that one pill or liquid or whatever dose. So that's one way to sort of address this issue of scheduling. The other idea that they have is to create a new government agency, the OMCCC, the Office of Medical Cannabinoid Council. Because right now, if you were to try to reschedule or deschedule, there are so many different agencies involved. It falls under Justice for crimes. It falls under USDA because it's an agriculture. It's a crop. It's a plant. It falls under the FDA because it's a food and it's a drug. Mm-hmm. It falls under banking. We talk about the Safe Banking Act, so it falls under that agency. And I'm probably forgetting a few, but every single agency, did I say Justice? I think I'm probably forgetting a few, but every single agency, did I say Justice?
Hold up. Sorry about that.
Okay.
Like we said, we get a few hiccups every now and again.
I hear myself. The bureaucracy, which is what we know governments is all about, is definitely something that can be a barrier. So these two ideas of creating a new agency and a new schedule is really brilliant as far as I'm concerned. They have a bill written, and if you want to go onto their website, the bill is written. Right now, they're trying to find a sponsor to back this bill. And what we do know is that legalizing cannabis is one of the rare bipartisan issues that exists. Republicans and Democrats alike really believe that cannabis should be legal at the federal level.
Yeah.
Well, it's definitely, the journey has been quite interesting, right? It's I think we make steps closer and then we get steps back. What a long name for an agency. That's a mouthful.
Yes,
you definitely need it.
I know. Maybe I'm feeling like maybe they need to take one of the C's out or something like that. And then it would be Yeah,
You
so
know, I think cannabinoid is such a big word for a lot of
it
people that they
is.
don't know what it
Mm.
is. So I feel like they could probably take that out where, you
Yeah.
know.
I'm sure they'll listen to this and maybe they'll take your advice.
Maybe,
I
maybe,
hope
Yeah.
so.
But it is pretty cool. And then, you know, there's the endocannabinoid system. I mean, it's a mouthful.
Mhm.
It
So
sure
yeah.
is. It sure is. So Faye, tell us a little bit about, so you're a nutritionist, but tell us a little bit about your consulting business and what you do when you're not hanging out with us cool gals
Right,
here.
which is great. I love hanging out with the cool gals. Well, what I do I do the same, very similar to what I do in my nutrition private practice, and I do still see nutrition patients as well. And sometimes some of those nutrition patients may be interested in exploring medical cannabis.
Yeah.
But so what I do is, the first thing I do is I do a 15-minute consultation call, and that's free because not everybody is a candidate for medical cannabis. And to me, that was my reason for going to college, to learn about it, because I was concerned about like drug interactions, particularly with these elderly people who would come in and they'd say, oh, I'm taking blood thinners, or I'm taking this, or I'm taking that. I was concerned from a medical professional standpoint. I didn't want to do anything that was harmful to them. So that's the first thing we do, is we do a 15-minute consultation. That's for free. And I have had people who have said, no, you know, you're really not a good candidate. This is not for you. So once they pass the 15-minute test, then and I do a consultation with them. And what I do is basically, I do work with patients in all states. And what I'll do is I'll look up, or I'll research the regulations within their state. I also have a cohort of people across the world, but across the country, who I went to school with, because our program is online. It always has been. So I might just, you know, like send an email to a friend in Florida, for example, if I have a patient in Florida, or, you know, whatever, and I'll find what the regulations are, because some patients need to be walked through the entire process. You know, how to register. I send them the link, how to, you know, provide certifying providers. I'll find some certifying providers. And that's where I'll also reach out to my colleagues to find some good certifying providers. Then I'll take a full medical history, you know, finding out what medical issues. And then from there, I'll make recommendations based on that history. And like I said, that big thing I'm watching for are drug interactions, because I don't want anything, you know, that could be a real problem. And the elderly tend to have what we call polypharmacy. They're on multiple drugs.
Right.
So we want to make sure that they're not, you know, we want to make sure that's safe. That's the thing. So then what I'll do is we'll look at the menu. So wherever they are, I'll kind of Google, or they may know the dispensary. Oh yeah, I passed this dispensary. It's called blah, blah, blah. Or maybe after the 15-minute consultation, I'll say, look for some dispensaries nearby that we can look at. And so I'll go on the menu while we're together on Zoom and kind of look, after I explain the endocannabinoid system and all about THC and CBD and what we're doing, then we'll go on the menus and I will explain what sort of formulation we're looking for. We want to determine, you know, some people do not want to inhale. They don't want to smoke anything. So then we're looking at tinctures or edibles. And together we'll sort of look at these menus and I will make recommendations. And as you probably know, the motto in cannabis is start low and go slow. So I've literally had people start with 1 drop of a tincture, which is like, should not do anything whatsoever, but that's how we roll, you know. One very small drop, and so we start so and go so. And I have a form that I send them, and they take it with them to the dispensary, and it just writes out, you know, I write out what instructions are, like start with this, you know, start with 1 drop, and we kind of, you know, I go from there. Recently, somebody emailed me and said, oh, I took your paper to the dispensary, and they said, oh, this lady really knows what she's doing. A lot of people do get recommendations from the bud tender or the patient care rep, but they may need something a little bit further and more in depth. And that's where I come into the picture.
That's so great, Faye, because, you know, it's really not that kind of script that we're so used to receiving from our regular primary that says take 2 and, you know, make an appointment in 2 weeks and let me know how you're doing. It's really not like that. In one hand, when you're used to that, it's very difficult to kind of change your mindset a little bit with that. But then on the other hand, it's also extremely empowering to be able to take, your healthcare into your own hands. And the fact that you can guide someone on that journey is really phenomenal. I mean, it's just amazing. And I think especially for our senior friends, I just think that's really so important. I think that some extra hand holding is just super for them, and makes it so that they can continue to have a wonderful journey using cannabis, as opposed to buying that one thing, having the worst experience ever, and then writing it off for the rest of their life.
Right. And, the other thing I do, by the way, Emily, is I ask them to keep a journal and sort of track, how they feel. Like, do you feel anxious? Do you feel, happy? Do you feel like tired? Or, we could have, so I want them to sort of try to tune into their body, because cannabis is individualized medicine, and it really is all about learning our bodies and learning how it helps us with the body. And I also, say to them, they can text me or they can email me with questions along the way. And then we do plan follow-ups so that we can see how they're doing.
That's so great. What an amazing service that is. That's really phenomenal.
Yeah.
Yes. Yeah. I mean, again, it's another cost, but, and I will slide my scale depending on the person that I'm working with. I have done that because I really feel that the safety component is so important, and I just want to help people.
Right.
Sure.
Yeah. Sure. That's great.
Awesome. Well, Faye, it's been great to chat with you this morning, and you're a wealth of knowledge. And thank you so much for all that you're doing to make a difference and advocate for patients in the medical program, because obviously we're very proud of it, and we really try our best to educate and share with people on how much it can really help in their wellness plan. And our best stories are when our patients come back and say, wow, if ever I knew a few years ago, and really it's made a difference in the lives of so many. So thank you so much for what you do.
Well, you're welcome. And I appreciate what you all are doing as well. We're helping to spread the word about this beautiful plant that can really help people improve their quality of life.
Absolutely.
Awesome. So my friends, thank you so much for tuning in today. And if you are catching the replay, feel free to drop a comment or a question. We will look forward. Emily and I will see you next week with our friends, Rich and John, who are a very fun duo. And we'll be talking about some cool cannabis products that I'm sure all of you will recognize, and we'll ask some great questions. So looking forward to next Thursday. Ladies, thank you again so much for your time. Make it a great weekend, friends. Stay cool if you're in the New England area, and have a great weekend. And we'll look forward to seeing you next week. But have a great day, friends.
Thank you. Good to be here. Take care.